Imagine this. You walk into the pharmacy to pick up your medication, only to find out it's no longer covered. Or if you go to your annual doctor's visit and discover your physician isn't in your plan's network anymore. Suddenly, what you thought was simple becomes complicated, expensive, frustrating. If you're approaching Medicare enrollment or are already enrolled, you may have a lot of questions and concerns. Am I choosing the right plan? Will my doctor still accept this coverage next year? Why do prescription drug prices keep changing? How do I make sure I'm not paying too much? These are real concerns, and you're not alone. The decisions you make about Medicare can impact your finances, your health care, and your peace of mind for years to come. Getting it right the first time and reviewing your choices regularly isn't just important, it's essential. Because if you don't, you can be caught off guard by unexpected costs or coverage gaps that could leave you scrambling. Today, we're going to walk you through how to navigate Medicare so you can avoid those surprises and have confidence that your health care is covered the way you need it to be. Welcome to Retirement Rescue Weekly, where we throw a lifeline to your financial future. This podcast is dedicated to helping rescue retirees from potential dangers that appear in retirement. I'm Kurt Arnold, your host and financial advocate. I'll guide you through the stormy seas of retirement. We'll tackle inflation, taxation, market volatility, and healthcare costs. Together, we'll secure your retirement. Tune in and start your rescue mission today. Well, hello, and welcome to another episode of Retirement Rescue Weekly. I'm Kurt Arnold, financial host and advocate. Today, looking forward to a topic that is a hard one to deal with. Medical costs and Medicare. It's really confusing. I know during the pandemic, I actually helped kind of teach a lot about Medicare. And I remember people sitting across the table from me saying, Kurt, I just don't get this stuff. Why do they make it so hard? Which I totally get. I remember during that same time, too, there was a lady I met. She was in her 70s and she was still working. I said, hey, what's your plan for retirement? And she says, my plan for retirement is I have to keep working until I can't work anymore because Medicare doesn't cover my prescriptions. And I also have a family member, too, that has seen rising prescription costs really affect them because it's something that Medicare doesn't cover. So I know this is a topic that keeps a lot of people up at night. So it's one that I think is really important. And we're going to kind of help try to clarify some things today and maybe help answer some questions for you, too. So let's jump into how we can unlock affordable health care for retirees. So let's start off with something funny, as I always like to do, with either a quote or a cartoon. And so this particular person is at Acme Healthcare, and the guy says, I'm sorry, but stress caused by trying to figure out your health insurance is not covered by it. I think we can get that one. I think if we dealt with an insurance company for a claim before, I think we all can appreciate that one. So why is this so big? There's a study recently that came out that said that a 65-year-old couple who's just retiring should expect to spend over $300,000 in retirement for healthcare expenses. And that does include long-term care, but Medicare type expenses, things like that as we age. It's a big number that we have to come up with. And if we don't plan for that as far as our retirement planning or don't plan for it as far as our income planning and retirement, could have a devastating impact. So it's important to really understand how we can minimize healthcare costs. Now, why is it critical to tie to your financial plan? Well, we know inflation, we talked about that in a previous episode, has a huge impact. Inflation for most expenses is around 3% historically, whereas medical expenses are 5 to 6%, so almost double. And that's actually something bigger and bigger too, as we continue to have more people that are going to need healthcare, but we have a lack of facilities and lack of workers. So that's going to be our own kind of healthcare pandemic that come down the line too, as far as that goes. We're living longer. Our healthcare advances are causing us to be able to live longer. As we live longer, we're more likely to have more healthcare challenges as we're living. And then that's going to have more costs that we have to cover. And also just to the math, if we're living, 75 and we go into our 80s and 90s, that's more years we have to cover as well. Market volatility, what we don't want to have happen too is, you have a major healthcare expense come up, which I've had a client a couple months ago had to have a major surgery, and it was something that was not covered, and she had to take a big withdrawal out of her IRA, and so that's something she was taking out. And it's something that, we don't know what the market's going to be like when that happens. We can't plan our health. So when that happens, we got to be really careful as well. So what are some consequences if we make mistakes with this? It could cause us to have to cut spending. If our medical expenses keep rising and we're on a fixed income, it may make us have to cut other things. It may mean that we take less vacations, or we can't go out to eat as much, or we have to really start, downsize or things like that. In some cases, you might have to return to work just to have some extra income flow to help us. And if we're taking money out from like investments, that's where we can actually add income and can also increase taxes. And we'll talk about that a little bit later too, but that's where we can have a lot of implications as well if we're taking it out at the wrong time. Today's episode is being brought to you by the letter M for Medicare. Medicare helps millions of Americans with health care after age 65, but it's not just one thing. It's made up of different parts, each with its own job, just like the letters of the alphabet. The letter of the alphabet. Let's start with Part A. Think of A for accommodation. Part A helps cover your stay in a hospital.
Go to the hospital!
Skilled nursing facility. Ambulance services. Or hospice care. Next is Part B. B stands for bigger bills that you may face at the doctor's office or for outpatient care.
I'm the doctor.
This may also include preventative care, medical labs,
let's check your blood work,
and durable medical equipment.
Doc says I should be on my bean and as good as new in a week.
And back on the force.
Third berg. That's wonderful. Whoa!
Come, Frank. Everyone should have a friend like you. That's C!
Part C is like the letter C for choose.
I can choose.
It's also called Medicare Advantage, where you pick a private plan that includes Part A and Part B, and sometimes extras like dental and vision. Last, we have Part D. D stands for drugs. This helps you with your prescription medications.
Their prescription drug plan.
Now, when you enroll in Medicare, there are two paths you can choose from.
Holy fork in the road.
Your decision has a major implication.
With a Medicare supplement plan, you pay a little bit more for coverage, but it fills in some of the gaps that original Medicare doesn't cover.
Let's just say I fill gaps.
Like deductibles and co-insurance.
You can go anywhere you want.
Or you can choose Medicare Advantage, which bundles everything into one plan.
Bundle is live!
Often with lower premiums, but limited networks of doctors.
There's a network.
So there you have it. Medicare can seem like a lot of letters, but once you know what each part does, it all makes sense.
It makes sense.
And remember, always choose the right path for your individual healthcare needs. All right. Well, thanks to Elmo and the Sesame Street gang for helping us with those letters. It feels like an alphabet soup sometimes when it comes to this insurance stuff, but hopefully you kind of understand. Original Medicare, Part A, you actually paid into that when you're working. So for most people, that's free. Part B, that's the part you have to actually pay that comes out of your Social Security. It's about 174 and some change right now, but that could go up. But also it could go up if your income gets higher too, which we'll talk about. And then you have the choice of the two paths. The one path is Medicare Supplement, where basically you're covering the gaps that original Medicare doesn't cover. And then you just pay a monthly premium, and then you don't have to open up your checkbook, and you don't have to worry about networks. You can go anywhere you want. So where this one's kind of key is if you're a snowbird, if you live in New York and you come to, like Florida, where I am right now, and you're going to be here for part of the year, that's kind of an important one, because then you don't have to worry about, I don't have to go all the way back to New York to be in network, or if I go here, it's out of networks, it's going to cost me more money. Or if you have some significant health challenges, sometimes if you're going to the doctor a lot, that's where a Medicare supplement plan could be advantageous. One thing to know, before you enroll, when you're first eligible to enroll, that first 12 months, you're automatically approved for a Medicare supplement plan. Otherwise, after that, you have to go through medical underwriting. So make sure you know that as far as your decision. Medicare Advantage plans, we talked about it being a bundle. It's meant to simulate like a workplace plan when you're working, where it has a network, it has an auto network, it has a copay, some max out of pocket. It's meant to simulate that. It does kind of bundle in some vision, dental, hearing, but those are more discount programs. Those are not really fully covered. Usually you can go to the dentist and get a teeth clean, but anything major, you're going to have a dental plan. So make sure you understand that. And usually the bundle usually includes a drug plan, whereas the supplement, you have to get your own drug plan each year. So make sure you know the difference between those things. So we kind of talked about Medicare supplement. Make sure you know how those work. Make sure you know the rules. When you get into a Medicare supplement plan, understand, don't always go for the cheapest one, because oftentimes those are newer plans who have less people in them. And sometimes when that happens, then they will have higher annual increases, which then can work as a disadvantage over time. So make sure you find a good, stable plan that has the least amount of increases over time. And then Medicare Advantage, that one doesn't really matter as far as increases, because, whether you're 65 or 85, it's going to be the same price for you. Just make sure it's a good plan, a highly rated plan. And then they usually throw some other bells and whistles into those plans as well. So make sure you're aware of those. Now, some things that people aren't aware of, but there's some things that aren't covered by Medicare. So what does Medicare not cover? It doesn't fully cover dental, vision, hearing, and long-term care. Now, like I said before, there are some discount plans where you can go to the dentist and get your teeth cleaned, or maybe get a bite wing. But anything major, which as we age, we have teeth pulled, we have dentures, things like that, that's considered major work, and that's not usually going to be covered by a Medicare prescription plan. So that's where you have to have a separate plan. And usually you have to have no gap in coverage, which means if you enrolled in a dental plan today, you might have to wait 12 months before you can actually use it. Vision plans as well, hearing. So obviously these are things, as we age, we're more likely going to need a dental plan, a vision plan, a hearing, things like that. And then long-term care. People think we automatically get long-term care coverage, but it's not. It's not true. It's only for skilled nursing. So anything that's a long-term custodian type thing, where someone comes to your home or you go to a nursing home, things like that, for those 6 daily living activities, those are the things that are not covered by Medicare. So let's take a look at a case study. This is Autopilot Abbey. Autopilot Abbey is somebody I worked with a couple of years ago. So she signed up for her Medicare plan and then didn't do anything with it. She just kind of left it, and she thought, well, this is the right plan. I'm good. I don't have to really worry about it. And what happened over time is her primary physician was not in network, and she started noticing that it was getting more and more expensive. And then she also noticed her prescription drugs. She thought it was just getting more expensive because of inflation. What actually happened was her formulary changed. So when it went from tier 1 to tier 3 or later or lower, it started costing more, and she didn't realize that. And for her, being on a fixed income, it was a big deal. So she really had to understand that. So she went and had it reviewed and found out she could be in a better plan for her. And then she got into a plan that actually was more cost effective for her, and huge difference for her as far as peace of mind. So one thing to know in 2 weeks is something called Medicare open enrollment, October 15th through December 7th. And that is when you're going to want to take some time to review your coverage. You're going to get an annual notice of change that's going to come in the mail. Make sure you take some time to review that and see what's changed in your plan. And if anything has changed, make sure you're looking at other options. Also, I always take a look at your health. What's changed in your health that maybe is going to change your coverage needs coming for the next year as well. And prescriptions, look at the formularies and make sure that you're still covered appropriately. If anything has changed, make sure that you're getting a different prescription plan. Now, going back to the two paths, the Medicare supplement plan, you can change the prescription drug plan with that. Or if you're looking at the Advantage plan, you might be changing the entire Advantage plan as a bundle. So make sure you're aware of that. Now, one thing I always tell people too is you kind of have to know how these things are covered. Your pharmacist does. So make sure that you can coach your doctors a little bit and say, hey, I have this plan, maybe give me a couple prescriptions, and then whatever one is best covered, maybe that's the one you do. Now, I'm not a doctor, so do whatever's best for your health. But if you have some options, see if you can pick one that's actually better covered so it doesn't cost you more over long term. Now, as we like to do on this show every week, we always want to make sure we're giving some education, but we also want to give you a resource. So one of the hardest things for people to figure out is which path should I take, the supplement or advantage plan. So we created this free resource that's going to give you some things to think about, some questions yourself, and things to think about your health. It's a decision tree to kind of help you understand each path. If you go to the link in the show notes below, you can actually get that downloadable resource, and we can get that for you. And it's a great resource that gives you a lot of things to think about as you're trying to determine which path makes the most sense for you. So that's going to bring us to an end of this episode. I hope this was helpful. I know this is a lot of information when it comes from the Medicare side. And maybe a lot of times you go to these seminars, it's very high level and it's not specific to you. And sometimes it's hard to know who to trust when you talk to these people within the Medicare industry. So make sure you're getting somebody that can help you, that's looking at you in a fiduciary relationship as far as what's best for you and not what's, makes the most commission, but what's best for you. So again, thanks for joining us. And again, we're here again next Thursday live at 11 a.m. on the East Coast, 8 a.m. on the West Coast. Until then, have a great week.